So, in collecting the objective data of the mouth, nose, throat, and sinuses is first, you should prepare all the equipments needed for the physical examination, one pair of gloves, 4x4 in gauze pad, pen light, and otoscope, tongue depressor, nasal speculum, and glass of juice. And to start the physical examination for the mouth, inspection and palpation, first is inspect and palpate the lips, observe the lip tissue consistency, the color, the moisture, and lesions. Next is inspect the teeth and gums of the patient. Ask the client to open and close mouth. Note occlusion number and shape, color, mouth, and condition of teeth like white, brown, yellow, chalky white areas. Note any repairs such as crowns and any cosmetics such as veneers. Ask the client to bite down through chewing on something and note the alignment of the lower and upper jaw. Next is put on gloves and retract the client's lips and check, cheeks to cheek gums for color and consistency. And inspect the vocal mucosa. Use a pen light and tongue depressor to retract the lips and cheeks to check for color and consistency. Inspect the Stenson ducts or the parotid ducts. Openings of the parotid salivary glands located on the buccal mucosa across the second, the upper molar. Next is inspect and palpate tongue. Ask client to stick out the tongue for color, texture, and consistency like black, hairy, white patches, smooth, reddish, shiny without papillae. Moisture, size, or enlarged or very small. Observe for fasciculations like fine tremors and check the midline protrusion. Palpate any lesions present for induration or hardness. Assess the ventral surface of the tongue. Ask the client to touch the tongue to the roof of the mouth and use a pen light to inspect the ventral surface of the tongue and frenulum and area under the tongue or the dorsal surface of the tongue. Next is palpate the area if you see lesions. If the client is over age 50 or if the client uses tobacco or alcohol, note any induration. Check also for short frenulum that limits tongue motion or the origin tongue tied. Next, inspect for Wharton's ducts or openings from the submandibular salivary glands located on either side of the frenulum on the floor of the mouth. Next is observe the sides of the tongue. Use a square gauze pad to hold the client's tongue to each palpate any lesions, ulcers, or nodules for induration. Check the strength of the tongue. Place your finger on the external surface of the client's cheeks. Ask the client to press the tongue's tip against inside of the cheeks to resist pressure from your fingers. Repeat on the opposite cheek. Next, check the anterior tongue's ability to taste. Place drops of sugar and salty water on the tip and sides of the tongue with the tongue depressor. Inspect the hard or the anterior and soft or the posterior palates and uvula. Ask the client to open the mouth wide while you use the pen light to look at the roof. Observe color and integrity. Assess the uvula and apply the tongue depressor to the mouth of the client or to the tongue of the client halfway between the tip and back of the tongue and shine a pen light in the client's wide open mouth. And note the characteristics and positioning of the uvula of the client and ask the client to say ah and watch for the uvula and saw palate to move. And next, inspect the tonsils using the tongue depressor to keep the mouth open wide and inspect the tonsils for the color, size, and presence of exudate of lesions. Grade the tonsils 2 plus, 3 plus, or 4 plus. And to inspect the throat of the client or of a client, first you should inspect the posterior pharyngeal wall, keeping the tongue depressor in place, and shine the pen light on the back of the throat and note any exudate or lesions. And next, note the odor of the throat of the client while the mouth is wide open and note any unusual or foul odor. And lastly, for the throat, before inspecting the nose, discard gloves and perform hand hygiene as always. And for the note, inspection and palpation for the nose, inspect and palpate the external nose for color, shape, and symmetry, consistency, tenderness, and patency of airflow by occluding each nostrils. So each nostrils. Next, check patency of airflow through the nostrils by occluding one nostril at a time and asking client to sniff or exhale. And last, for the nose, for the inspection and palpation for the nose, inspect the internal nose with a head tilt and with the use of the otoscope with a short, wide tip attachment, or you can also use a nasal speculum and pen light. Note the color, swelling, exudates, bleeding, ulcers, and perforated septum or polyps. If there is any swelling in the nostrils of the client. And lastly, for the sinuses, first is you should palpate the sinuses, the frontal sinuses, by pressing upward just below the eyebrows and maxillary just below the eyes for tenderness here. And last, percuse the frontal sinuses above eyebrows and maxillary sinuses just below the eyes with direct or immediate percussion. And that's the collecting objective data for the mouth, nose, throat, and sinuses.